May is Mental Health Awareness Month, and we know that as we come out of the pandemic, talking about mental health and well-being is just more important than ever. So joining me now is Carrie Ladd with the Mental Health Center of Denver. And Carrie, we know calls to the Colorado Crisis Center are up on average of 30%. What are you guys seeing at the Mental Health Center of Denver?
So at the Mental Health Center of Denver, what we're noticing is that folks are staying in services longer. So perhaps they would have transitioned out of services, but as those needs become more complicated and more layered due to the pandemic or contributing by the pandemic, folks are staying around.
Perfect. And we know the pandemic has been hard for so many people on just different levels. What types of mental health concerns have you seen the most during the past year?
So I actually work at the Walk-In Crisis Center off of Claremont and Colfax. So we're open 24/7 and see folks for self-defined crisis. What we're seeing is just really a little bit of an increase in complexity. So not only are the normal sort of reasons that folks come in to see us present, but also more layers. So perhaps a job loss or a change or being home, working from home, not having those usual outlets that folks are able to modulate their mental health with.
Right. I'm sure that can cause a lot of things like just anxiety and depression. What are some of the resources that you guys offer for people in the community, or where can people turn, or what do they need to know?
So the walk-in crisis centers are fantastic resources. There are several throughout the Denver metro area. Like I said, we're open 24 hours a day, 7 days a week, and it's self-defined crisis. So if it's a crisis for you, it's a crisis for us. There's also the Colorado Crisis Line. That phone number is 1-844-493-8255, or you can text TALK, T-A-L-K, to 38255. Also a fantastic 24/7 resources for folks to get connected right away.
Wonderful. And why is it so important to raise awareness about mental health and get that conversation going? Of course, in May, because that's what this month is all about, but really just always.
Absolutely. I think the more aware we are of what mental health is and when you're experiencing it, the more people are able to reach out for help or get support. I think if we normalize mental health just as we have physical health, it really allows people to get what they need and then move on with their lives in really healthy, happy ways.
Wonderful. Is there anything we haven't covered that you want the community to think about or know during these times?
I think, again, it's just really normalizing the conversation, reaching out, asking for help. There are fantastic resources in our community, not only Mental Health Center of Denver, our Walk-In Crisis Centers, our Crisis Line. We are very lucky in Colorado to have a robust mental health care system. So know when you need to access it and go talk to someone. It can be really helpful.
Wonderful. And if someone has a loved one or a friend or family member that they see are struggling, what should they do?
Be there for support. I really like to use kind of comments as opposed to questions. I notice you're struggling. I'm here if you want to talk about it. Sort of decreases the amount of pressure that someone feels to answer right away, but also sort of plants that seed that lets them know you're thinking about them and that you notice them. Most of us just want to be seen.
Wonderful. Thank you so much for all that important information. We really appreciate your time today.
Thank you so much for having me.
Of course. And we'll have more information on the resources available on our website, cbsdenver.com.